I'm excited to talk about this new care model that is generating a lot of interest locally and nationally. This model is about developing community pharmacies to support physical monitoring in children and young people prescribed psychiatric medications. Through this model, we are able to increase patient access as well as make significant efficiency savings.
Well, the pharmacy's closer, it's on my doorstep. I can do it at a more convenient time for me, having the 5 kids. You know what I mean? It's just a lot easier. It takes the stress out of having to drag all the children around with me, because I can do it once, like my husband's home, because the chemist is open obviously later as well now. And that it's more convenient. I can make an appointment, or I can just go in there either and just wait. So there's none of this, I've got to stick to a time limit and got to get it done because I've made an appointment with the doctors to do it. And it's just like a far more friendlier atmosphere. You know what I mean? You can go to a nurse, but when you've got a child with issues, they might not get on with that nurse. So with pharmacy, it's just more personal. It's a shop we go in as well regularly for medicine. So it's just a far more personal experience. Okay. He likes it because Helen lets him feel like he's participating. He'll stand there and have his, pull the thing down onto his head, and he'll put the blood pressure thing on his arm. Great. So he participates in it as well, so it's not so stressful on him. He's not just got somebody telling him what they're doing and doing it. He participates as well, you know what I mean? And he takes all the information in on the screen, make sure they're doing it right. He'll even tell them off if he thinks they're doing it wrong. So, but it's a little bit more personal for him as well. He knows what's coming and he's involved in it.
Okay.
And like I said, he's even asked if he can go in there on his own. I was like, you're only 12, not quite at that stage yet. You know what I mean? So he has, because we went up last night, and he said to me, "Well, can I get off the bus and go on my own, Mum?" I went, "No, I still need to come with you." You know what I mean? You're not quite there yet.
Brilliant.
You know
But in the future.
Yeah, so when he gets a little bit older, then maybe Helen will be happy for him to go up on his own and have it done.
Absolutely.
So, like I said, he gets involved while having it done.
Okay.
Like I said, it's just so much easier. I don't have the stress of worrying about it and that. And if you request it, then I get a phone call.
Yeah.
We need you to do it. CAMHS have requested it, and I can go up. It's 5 minutes up the road. Do you know what I mean? We were gone 10 minutes last night. From leaving here to getting back, literally 10 minutes.
I think that it's really helped as part of an overall restructuring of our ADHD care pathway to provide care that's a lot more family centred. So families now have a lot more choice. They have a degree, they have choice in where they can have their observations done, which strangely enough leads to choice in other parts of the pathway, in that it's created flexibility in when people can have their appointments, because there's a little bit more time along with the other structural changes. It's created flexibility in what can be discussed in that appointment, because you know that you have the readings prior to the appointment, and therefore you might actually get onto what the families and young people are finding most important to talk to in the appointment. As a clinician, it creates a layer of security, I suppose. So I can ask for more frequent checks in situations that I'm concerned about, and maybe reduce the number of intrusive checks when that's not required. So yeah, I think for me the flexibility aspect as well as the choice aspect are two of the biggest positives about the project. Yeah, I think what's been really useful for me, and I have to confess that I was initially sceptical. I was worried that this was another way to create efficiency. I think a reshuffling of a service with gaps in provision. And so for me, what's been most surprising is actually the fact that hasn't happened, and that we've been left with something that's more responsive, lighter on its feet. And I think that's because it's come as part of a wider restructuring, and it's created the momentum for us to make sense of an ADHD clinic. I think you have to bear in mind that in every service I've worked, ADHD clinics are full of young people and families whose needs are not clearly understood, and they often are very, very complex, but given the least of the resources. They've often had a very inadequate workup. There's an expectation that they can be seen every 6 months to a year, and tweak the medicine, and that would be a solution to often very difficult entrenched needs. And so, you know, anything that can provide a better service for that group is vital, I think. I would definitely like it to continue. I think we can continue to do more actually in evolving that process, evolving the changes in the pathway with the pharmacy project at the heart of that, the monitoring part of that.
It's a fantastic idea. I like the service, and it's quite straightforward. When you call the patient and they book an appointment, they come in at the right time and get it done. So I think it's quite easier for the patients as well, because accessibility wise, they're able to come to the pharmacy. And because we open from 8 to 8, they've got a lot of hours they can come in. So I think most of the families are quite happy with the times, because most of them tend to come in the evening. So that works out quite well for them. So yeah, it's a good service. They're quite happy with it. The children are quite relaxed as well, because some of them are like, oh, it's not hospital money. So I think they're more relaxed. Maybe it's not more of an health environment. It doesn't seem that way to them. Yeah. So they're quite relaxed, and they come in with their younger ones. They stand there, they play around. They're quite free. And I think the children like it more, because it's a less hospital environment. Yeah. Let's put it that way. It's trying to get them on, some of them, not all of them, trying to get them to book an appointment, because when we get the referrals, we then have to call the patient to book an appointment. But aside that, everything else is fine. And we've, aside the pharmacists, because other staff members can do it as well, we've got an ACT and pharmacy technicians. So they've been trained, I think they attended the training as well. And so they can do the service. So all I just need to do is they do the service, and I can just overlook it, check, and make sure everything is fine, and we can sign it off.